You're alone at home. Outside, everything seems calm. But inside, something feels off. A strange fatigue, a pressure in your chest, a wave of dizziness. You ignore it, thinking it's just stress, maybe lack of sleep. But what you don't know is that your body is screaming for help, softly, quietly, in a language most people never learn to understand. There's a disturbing truth that few ever talk about. Heart attacks don't always strike like a bolt of lightning from the sky. Sometimes, the heart whispers before it screams. And if you don't learn to listen to those whispers, you might not get another chance. The most shocking part? Up to 7 days before a heart attack, your body can send you clear, precise warnings. Signals that something deep inside is failing, but almost no one recognizes them. That's why today, I'm going to reveal the 7 most common symptoms that can warn of a heart attack up to a week in advance. And I promise you, the last one, number 1, is the most silent, and the one that takes the most lives every single year. Because here, at Healthy and Positive, we believe every decision you make today brings you closer to, or further away from, a healthy heart tomorrow. So stay with me, because recognizing these signs in time could save your life, or the life of someone you love. Symptom number 7, unusual fatigue. You think fatigue is just a part of daily life, a rough day, a few sleepless nights, too much to do. But what if I told you that sometimes, exhaustion is not just tiredness, it's your body crying out for help? When you feel an extreme, unexplained fatigue that appears even during simple tasks, like climbing stairs or walking across a room, that's not normal. That's your heart struggling. When your heart doesn't get enough oxygen, every muscle in your body starts to slow down, begging you to stop. A 2021 study from the University of Arkansas found that more than half of heart attack patients reported feeling unusual fatigue in the days before the event. Half of them felt something was wrong, but they didn't know it was their heart asking for help. The most deceptive part is how easily we misinterpret it: stress, age, lack of sleep. But when fatigue is new, intense, persistent, and doesn't go away with rest, your heart might be warning you that something is deeply wrong. Symptom number 6, pain in the neck, jaw, or back. Most people think heart attacks only cause chest pain. But sometimes, your body plays a cruel trick: the pain hides elsewhere. Pain that radiates to the neck, the jaw, or the back can be one of the most misunderstood signals of heart distress. Why? Because the nerves that transmit pain from the heart are connected to those other regions. So when your heart is in crisis, your brain gets confused, it sends the alarm to the wrong place. You might feel a strange ache in your jaw, a stiffness in your neck, or a dull pressure in your back. And never realize it's your heart crying for help. A 2022 study from the American Heart Association confirmed that these atypical pains are especially common in women and people over 45. It's as if the body were speaking a language we never learned to translate, until it's too late. If the pain feels vague, spreads slowly, and doesn't improve with rest or painkillers, don't wait. Get help. Symptom number 5, shortness of breath. Have you ever felt like you just can't catch your breath, even while resting? That sudden inability to breathe deeply, especially when it comes with fatigue or chest pressure, can be a red flag. When the arteries of the heart narrow, less oxygen reaches your lungs. Your breathing becomes shallow, desperate, your body gasping for something it can't get. A 2022 Harvard University study found that shortness of breath is one of the most frequently reported symptoms 5 to 7 days before a heart attack. But the most dangerous mistake is to assume it's just anxiety. Anxiety doesn't usually appear while you're doing nothing. But when shortness of breath hits you out of nowhere, when you feel like you're climbing stairs even when you're sitting still, that's your heart sending an SOS. Symptom number 4, cold sweats and sudden dizziness. One moment, you're fine. And the next, a wave of cold sweat, a strange weakness, your vision blurs. It's terrifying. And yet, most people don't connect it to their heart. They think it's low sugar, maybe the heat. But your heart, it knows better. When your heart doesn't get enough oxygen, it panics. Your nervous system triggers a full-blown emergency, cold skin, dizziness, sweating, as if your body is trying to defend itself from within. A 2020 Mayo Clinic study found that 30% of heart attack patients reported cold sweats and dizziness in the week before their attack. And the tragic truth is that most ignored it until it was too late. Symptom number 3, nausea, vomiting, or stomach discomfort. It sounds strange, doesn't it? That your stomach could warn you about a heart problem. But the body is full of secrets. The vagus nerve connects your heart to your stomach, and when the heart is in distress, the signals get crossed. You might feel nausea, acid reflux, indigestion, and think it's something you ate. A 2019 Johns Hopkins study found that nearly 20% of heart attack patients experienced digestive discomfort in the days before their event. What makes this symptom so deadly is how ordinary it feels. It's not dramatic. It's not painful. It's just uncomfortable. But sometimes, the simplest discomfort hides the darkest danger. Symptom number 2, chest pressure or pain. The classic one. The one we all know, and yet, the one most people ignore. Chest pain isn't always sharp. It can feel like a weight, a burning, or a pressure that comes and goes. People say it feels like an elephant sitting on your chest, and they're not exaggerating. A 2021 University of Michigan study revealed that 70% of heart attack survivors had experienced chest discomfort days before the attack, but didn't act. They told themselves it wasn't serious. They waited. And waiting almost cost them their lives. If you ever feel a squeezing pressure, even mild, don't rationalize it. Don't wait for it to pass. Your heart doesn't need time, it needs attention. And now, symptom number 1. The most silent. The most deadly. The one that kills millions without making a sound. Uncontrolled or unstable blood pressure. This is the true silent killer. You can live with high blood pressure for years without a single symptom, and all that time, it's destroying your arteries, weakening your heart, and setting the stage for catastrophe. Hypertension doesn't shout. It whispers, quietly damaging you while you feel fine. And when it finally reveals itself, it's often through a major event, a heart attack or a stroke. Even if you don't have chronic hypertension, sudden fluctuations in your blood pressure can be a deadly warning. A 2022 Stanford University study found that abrupt changes in blood pressure were among the most frequent indicators seen in patients days before their heart attack. And the saddest truth? Most people don't even check their blood pressure. They walk around, unaware that every heartbeat is like a spin of the roulette wheel, hoping it won't be their last. So now you know. A heart attack doesn't always come without warning. Sometimes, your body gives you a week to prepare, a week to act. Fatigue. Neck or jaw pain. Shortness of breath. Cold sweats. Nausea. Chest pressure. And unstable blood pressure. Each of these is your body's way of saying, I need help. Never ignore these signs. Never wait until tomorrow. Because tomorrow might not come. Tell us in the comments, which of these symptoms have you felt before? Your story might save someone's life. And if today you learned how to recognize the signs that come before a heart attack. In the next video, I'll show you 3 proven techniques that could help you survive one, even if you're home alone. The question is, would you know what to do if your heart stopped right now? Don't miss it. Click on the video appearing right here on your screen, and I'll see you there. Because here, at Healthy and Positive, we keep building together a stronger heart, a healthier body, and a much longer life. Important, this video is for informational purposes only. If you experience any of these symptoms, seek medical attention immediately. See you in the next one.